Did you know that drinking lots of water is not good for your kidney health? Did you know that if you suffer from tiredness and fatigue, there could be an easy fix? Did you know that going to the gym too often is not good for your creatinine levels? This and more in today's video. Hello, this is Catherine. Welcome to Double O Kidney. Today I'll show you the top 10 secrets backed by science you need to know to lower your creatinine level fast and to keep your kidneys healthy. Science progresses fast every day, and keeping up with all the latest studies and researches is not easy. So today I'll show you what you really need to know if you care about your kidneys. Secret number 10. Drinking too much water can be harmful for the kidneys. Some doctors are actively recommending kidney disease patients to drink a huge quantity of water every day to lower creatinine levels. Fact: those doctors aren't nephrologists usually. According to recent studies, drinking too much water daily not only won't help your kidney health, it can even make things worse. The recommendation drink at least 8 glasses of water a day has become a mantra of the press and of any health-related media. But the reason that physicians tend to advise such an increased fluid intake may be outdated. The studies suggest, yes, an increased fluid intake as a way of cleansing the kidneys is not supported by modern evidence-based medicine. What these new studies seem to suggest is that excessive urination means that the kidneys have to work more. They need to process a lot more fluids to maintain proper balance in the body. And I'm not just talking about people in the advanced stages of kidney disease who are usually given a fluid restriction here. So, what should you do to maintain the correct fluid balance without overhydrating? You should be what the experts call water-wise. Being water-wise means drinking enough water or other healthy fluids such as green tea and tisanes to quench the thirst and to keep your urine lightly yellow or colorless. When your urine is dark yellow, this indicates that you are dehydrated and you should drink more. Just don't overdo it. Finding the correct water balance is the smartest way of keeping the kidneys healthy and lowering creatinine. And while this could look like a small step towards solving a problem as big as kidney disease, it is already a step in the right direction. So, if you know anyone who could benefit from improving their kidney function, share with them this video now. Send them a WhatsApp message or use the share button below. Secret number 9. Exercising too much is not worth it. Have you ever met someone so obsessed with weightlifting and working out that they plan their whole day around it? Well, they may be putting their kidneys at risk. Exercise is supposed to be good for you, but exercising too much or running too fast can have serious consequences for your body and your kidney health. It's just a misconception that exercising more is always better according to several studies. Experts say that spending several hours on the treadmill or lifting too much weight at the gym could damage your heart and arteries, lead to injuries, and even make you addicted. By overexerting yourself, you may just be stressing out your body more and causing your cortisol level to rise and keep your body in an unhealthy condition. Cortisol is the stress hormone. Having too high levels for too much time can cause serious problems, and it also overworks the kidneys. Creatinine levels are higher in case of strenuous exercises, and this means that the kidneys are overworked too. High creatinine levels are the #1 indicator of decreased kidney function. So, how much should you exercise? Focus more on regularity than quantity and do lighter exercises. Yes, even walking every day counts as exercising. Secret number 8. Drinking milk is not healthy for your bones. A research from Harvard Medical School shows that drinking milk can increase the risk of bone fractures. Yes, you heard me right. Drinking more milk can actually make your bones more brittle. And while this is not true for everyone, people with kidney disease should always watch their dairy consumption. Why? Researchers found out that the consumption of milk and other dairy products increases the excretion of calcium in the urine of kidney disease patients. This is due to the fact that milk causes the body to take calcium from the bones. How is this possible when milk and calcium are actually supposed to improve bone health? Well, the answer is phosphorus. The kidneys have the important role of maintaining the balance between phosphorus and calcium in the body. Milk is rich in phosphorus, and in case of kidney disease, the kidneys are not able to filter phosphorus as they should. When there's too much phosphorus, the body needs to remove it, binding it with calcium. And it will take this calcium from the bones. So the result of drinking milk is less calcium in the bones and more stress for the kidneys. What to do to get some calcium without too much phosphorus then? Foods that naturally contain calcium and are safe for people with kidney disease include rhubarb, sardines, and salmon with bones. It's not a long list, so the best sources of calcium for people suffering from chronic kidney disease are fortified foods and supplements, since dairy is to be avoided. Supplements should be prescribed by your doctor. Secret number 7. Salads are not as healthy as they look. Okay, now you may ask, what is wrong with salads now? Yes, a salad can be a low-calorie, healthy part of a meal, but only if you do it correctly. The problem with salads is that veggies are not so tasty, while dressings, sauces, and croutons, on the other hand, So most people get excited by the mixings and end up creating a salad that will be more calorically dense than a dessert. Yes, the veggies in the salad are healthy, but the excessive dressings definitely aren't. So before you give yourself a pat on the back for eating a salad for lunch, also consider this. Most dressings are too rich in salt for any healthy diet, and your kidneys absolutely don't like too much salt, not to mention the lack of nutritional value and the content of sugars and trans fats. And fat-free dressings aren't exactly healthy for you either. They can be packed with additives and sugar, poison for your kidneys. Fancy a salad? Avoid dressings and excess sodium. Secret number 6. There's an easy fix for fatigue and tiredness. Even people sleeping well may have fatigue and a lack of energy if they suffer from kidney disease. Now, some good news. In a lot of cases, this could be fixed easily. How? In people suffering from kidney disease, fatigue is often caused by anemia, a condition in which you don't have enough red blood cells. When your kidneys are not working at their best, they can't make enough erythropoietin or EPO. EPO is a hormone that our body needs. It acts on the bone marrow to stimulate red blood cell production. When there is not enough of it, the body can't carry enough oxygen to the muscles. This is a condition called anemia, and one of the main symptoms of anemia is fatigue. The muscles cannot work without oxygen, nor can the brain, so people suffering from anemia can feel extremely tired and fatigued. Other symptoms of anemia include cold hands and feet, chest pain, dizziness, and inability to focus. Anemia is common in CKD patients and can be managed. How? Your doctor can prescribe you iron supplements and erythropoietin, a hormone involved in the production of red blood cells. That would solve the problem easily. Talking about an easy fix. By the way, did you like this video so far? Give it a like. We are in the top 5 now. Some incredible health secrets coming ahead. Number 5. Some supplements can kill your kidneys. Herbal remedies are supposed to be healthy for you, right? Well, not always. Actually, there is a chance that your kidneys may be damaged by taking them. Have you ever heard about the Chinese herb nephropathy? In 1994, a 44-year-old woman progressed from normal renal function to advanced renal failure and end-stage renal disease within 8 months. Incredible! In just 8 months, she went from being healthy to needing a kidney transplant. And this is all documented by the specialists that treated her. It's not alarmism or fake news. The cause of the renal failure? A Chinese herb medicine for pain relief her acupuncturist prescribed her. When the samples of the herbal remedy she was using were sent to Belgium for analysis, it was clear that the herbal remedies she ingested literally killed her kidneys. This was the first time they diagnosed what is now known as the Chinese herb nephropathy. And while not all supplements are dangerous, US health officials have issued more than 700 warnings during the last decade about the sale of dietary supplements that contain unapproved and potentially dangerous drug ingredients, according to a new research. Several supplements have been linked to an increase in certain cancers. Others have been tied to an elevated risk of kidney stones. Secret number 4. Don't lose sleep if you care about your kidneys' health. 1 in 3 Americans say they do not get enough sleep. If you are one of them and you know you are not sleeping well, I have other bad news. Lack of sleep has been linked by recent studies to some health problems such as infertility, mental health problems, weakened immune system, weight gain, and even diabetes and heart disease. Lack of sleep and sleep deprivation challenge all the organs in the body, the researchers say, since regular sleep cycles are needed to maintain the homeostasis, the critical balance of the physical and chemical conditions of the body. And the kidneys may be the organ more in danger when not sleeping enough. A study from the Boston's Brigham and Women's Hospital directly linked poor sleep to a rapid decline in kidney function. People who slept 5 hours or less were those more at risk of rapid kidney function decline. Yes, not getting enough sleep on a regular basis can have severe effects on your kidney health. Researchers think that the body's natural rhythms, or so-called circadian clock, might play a crucial role in the kidney damage done by lack of sleep. The kidney is timed to work differently during the night than during the day because the demands on the body are different. But what if you can't sleep that well, or you just don't have enough time? My advice: if you can't get enough sleep at night, try to catch up when you can. Take a nap in the afternoon and sleep in a little later on the weekends. Do whatever you can to increase the amount of sleep you get, or try the next kidney health tip. Secret number 3. Meditation can lower high blood pressure. While meditation is a staple of the healthy living style of many Oriental cultures, I really feel that it's underappreciated in the Western culture. I mean, when was the last time your doctor recommended you 10 minutes of meditation to lower your high blood pressure? Still, there have been several studies in the last years proving the benefits of meditation from a scientific point of view. According to a research published in the Journal of Neuroscience, meditation can reduce pain in people suffering from chronic conditions. Another study suggested meditation can even reduce brain aging and that it can help with insomnia. And there's a study even more interesting for people suffering from chronic kidney disease. This study, published in the journal PLOS ONE, found out that sitting comfortably and closing the eyes for 20 minutes twice a day is not just a great way to relax, it can even lower blood pressure. And this is really helpful for people with CKD, since high blood pressure is the second leading cause of chronic kidney disease. So it actually seems like meditation could be a great way to lower creatinine levels fast. Who could have guessed? Secret number 2. The kidneys do a lot more than just filtering the blood. As we've already seen, failing kidney cannot produce enough EPO, causing several health problems. What not everyone knows is that the kidneys are responsible for the production of several substances and hormones your body needs, and the lack of these substances can cause problems with other parts of your body. I'm talking about hormones like erythropoietin, calcitriol, and renin. Renin is an enzyme that helps control your blood pressure. Now, the problem with renin is that when the kidneys start to fail, they release more of it in response to sensing decreased blood flow to their functional filtering units, the glomeruli. In chronic kidney disease, there is an increased loss of these filters beyond the normal loss we all experience beyond the age of 40. This loss of functional units can contribute to elevated blood pressure over time, but high blood pressure in itself can precipitate further loss of functional units, a unique situation that can cause a lot of problems. Statistics say that 80% of patients with chronic kidney disease will eventually develop hypertension, even if they didn't have it before developing kidney disease. So, and this is a very important kidney health tip: always keep your blood pressure under control and check it regularly. And before I'll show you our number 1, a lot of people here are using this program to improve their kidney function and lower their creatinine levels. Yes, there are some very inspiring success stories here in Double O Kidney. People were basically able to reverse their kidney disease thanks to what they learned here. I'm leaving a link here if you want to know more. And our number 1 kidney health secret is: you must learn to take care of your health the best you can. Our health is probably the most important thing we have, no doubt about it. So keep getting informed and never stop fighting for good health. This is all for today. Thank you for watching.